Welcome, Dr. Kirby.
Thank you so much. Happy to be here.
You are at LaserAway.
Yeah, I'm really fortunate. We're the nation's leading aesthetic dermatology group. We have more than 150 clinics. We're in 30 states. We love patients who are inquisitive, because the word doctor is derived from the word doctorate, which means to teach. So I love to teach, and that's what I think. If you said, what does LaserAway do best? By far, the thing that we're the best at is teaching. We will provide you with information, teach you about everything, and then kind of, again, I'm repeating myself, but work together to figure out what you're trying to achieve.
What the program is.
Yeah.
Okay, so that's what you meant by come in, we'll give you the whole...
Well, and obviously, as the name suggests, we emphasize energy-based devices and injectables we have, and then topical products as well.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Selah, a Californian through and through, and we're your co-hosts.
That's right, we're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts. Now, it's called LaserAway, and you mentioned earlier that you do specialize in lasers and what did you call them?
Energy-based devices.
Energy-based.
Yeah.
So is that inclusive of CoolSculpting?
Yep.
And okay.
So, and there's a lot of different ways that you can categorize the different treatments in aesthetics. You could, very simply, you could say sort of face and body. And I think that that's totally fine, but it doesn't, it's not objective enough. It doesn't delineate things enough. So there's body contouring. I guess I'll go in the order of like most common and most popular.
Yes.
Laser hair removal is wildly popular. It works exceedingly well. It's safe for everyone to get it. And you can argue with me all you want about trends, and we talked about trends of like the Baywatch, breast augmentation trend or being overfilled as a trend. Well, a trend that I don't think is ever going to be popular again is underarm hair.
Right.
Maybe it is, okay?
Well, I did see it coming back with Gen Z.
My point is, who am I to judge? But I'm personally not attracted to hairy armpits. I don't think they're coming back.
I'm not.
Okay.
So as an example, hair removal in the underarm it's wildly safe. It works astonishingly well because it's a sun-protected area.
Oh, right.
Hair that is coarse, dark, and dense responds best.
Because you knew I was about to go there, because I'm a melanated sister. And I was about to say, is it safe for me?
Hair removal is safe.
Everybody.
Hair removal is safe for all
It sounds
6
like
skin
it's
types.
not as effective for lighter hair.
So what's interesting is you have to have a chromophore. And that chromophore has to be pigmentation in the form of melanin. So it won't work for red hair. It won't work for work for blonde hair. It won't work for silver or gray hair. Because that's a universal truth of hair removal.
I was about to say, I did it and I did not see results. I saw a little bit, but not really. That is
so hair, the color of hair is really fascinating. Like if you look under a microscope, and we're going to talk about you if that's okay.
No, that's fine.
I mean, please. She's a case study right
I'm a
now.
case study.
Go, Dr.
Your
Kirby.
hair is, just looking at it, if it's in the underarm, if it's dark enough to respond, we'll know very quickly if you'll get a response. But you're probably not going to get as good of a response as Melissa, or that I did when I had dark hair, because I had the bottom of my neck done and the back of my neck done. So every man listening to this, or if you have a male partner, he needs to get the bottom of his neck done, because with the bottom of the neck, you get ingrown hair,
Right.
you get irritation, and then when you have laser hair removal here and I don't shave here, I just look clean cut. So there's, a lot of it's just grooming and making your life a little more simple. But underarm, it can't be fun to shave your underarms.
No.
And and unfortunately, you're going to be relegated to that because there isn't a great hair removal option for you. It can be thinner, it can be finer, but you're probably not going to get a 100% reduction.
wow. And bikini, I assume the same, because I did the bikini.
So it depends. If that hair is dark and dark brown and then it'll work better.
Well, not to give the audience too much information.
I think
we
we're
go.
already there. I think we're already there.
This was PG. Now we went.
Is it? Go ahead.
Well, I was just going to ask. I found it a little painful, but this was many years ago. I'm sure the technology has changed, or
There's been a huge jump in technology, probably within the last 10 years. It's much more tolerable these days. In the interest of being really forthright,
Please.
The underarms don't hurt very much. It's just not an area of dense neural conglomeration, right? The bikini area, much
really
more
hurts.
sensitive. It's a more sensitive area, that is going to be more sensitive. But, legs aren't bad at all. But that's
Okay.
upper legs, upper thighs, not that bad. If you go to the tibial area where there's very little fat, it is more uncomfortable
sensitive.
there. Yeah. So some areas are more sensitive. And if they're already more sensitive, well, they're going to be that
That's
same
true.
level of sensitivity. But that's why I like to start people with underarms, because then they understand the process. They see a great result and they're like, oh, let's go downstairs and, treat other areas.
Do
my whole body.
Can we go back to cool sculpting?
I would love
Let's
to,
go back
yes.
to cool sculpting. What is cool sculpting?
So CoolSculpting, the name sort of tells us what it is. It uses cold energy to offer contouring of the body. Now, it's not going to remove massive amounts of weight. There's a lot of ways to do that these days. Liposuction, dieting, exercise, and the new semaglutide medications. But CoolSculpting definitely contours and, as the name suggests, sculpts.
Okay.
So it's a device, and it uses the mechanism of action, the MOA, is cryolipolysis. Cryo being cold, lipo being fat, and lysis is the Greek word for destruction. So it uses cold to destroy fat. And this is a really simple at-home thing. If you have any pockets of fat you want to destroy, and no matter what kind of shape you're in, everyone has a little fat somewhere that they don't want. And if you can pinch that fat with your thumb and your index finger, then you're a candidate for cool sculpting. So you know what I mean? You go, lock the door, go in the bathroom, take your clothes off, and then find out areas where you can pinch fat. And if it's pinchable fat, then you can remove 20 to 25% of the fat that gets sucked into the handpiece. It has a handpiece kind of like a butter. You know what a butter? What is the?
Oh yeah, there's there's
do you
a
put over
name
your
for that.
butter?
I know what you're talking about. Okay.
So the hand pieces, and they range in size, but basically 20 to 25% of what gets sucked up into that during the treatment will be permanently destroyed.
Now, is it okay? You said permanently. That was my next question. Now, if it comes back, can you do it again?
You can now, and I mean,
Would it come back to that spot?
Not
No.
if, but when.
No.
the answer. So you're not. What I explain to people is this does not give you a golden ticket to the buffet, right?
Right.
Like it works best with lifestyle modification,
and
diet,
exercise,
exercise.
of
So
course.
every once in a while, not often, but someone will come in and they're like, "I got cool sculpting and I gained 5 pounds," and it's like, it wasn't the cool sculpting. We're not pushing anything in. So I'm a huge fan of body contouring, cool sculpting, but it comes down to patient selection and patient education. And that's really the big difference here.
And then if it did come back, if you did gain weight, would it come in other spots?
Yeah, you're going to get in other
Like
places. I
lipo?
mean, you might get exactly.
Okay,
I-
all right.
I mean, what it does permanently destroy those fat cells, but again, we're talking a minimal to moderate amount of destruction. We're not doing large amounts of destruction.
Like lipo does.
And like lipo does. And then, also, I'd be remiss if I didn't talk about the semaglutides. It's not something we offer, but it's changing the entire industry. And people are losing a ton of weight, and then but they still have pinchable pockets of fat. So they're still, because they have lost weight in a lot of places, but it's not going to lose the weight where you want it to. It's where your body's going to lose. So you still may have a little bit of
That you wanna
extra fat on the thighs, or men more in the love handle, women more in the thigh area.
Right.
So there still might be some body contouring that you want to consider.
Are there multiple treatments? Is that what it is? Or is it like I come in one time and I'm done?
For you, it's one time. But it just depends how much you're trying to destroy and what your ultimate cosmetic goal
What your
is.
goal
Sometimes people, sometimes people will get 4 sessions and then, really go down on the diet and exercise and then wait a year and then consider more. But it's a function of, of course, the more you do, the better it works. But it's all based on the individual.
It sounds perfect for somebody like me who I used to be a
You're a
personal
busy
trainer.
mom. I mean,
Right. And I as a trainer and a fitness instructor, I would work out hours a day. But yeah, now I'm a busy mom.
well, you can't, if you
can't do that.
You know that you can't spot reduce. Like ask any trainer.
That too. Yes.
You can get shredded. Your face will be gaunt. You'll have a 6-pack, and you'll have fat in areas you don't like it.
Yes.
That's the way physiology works. So this targets those areas.
Exactly. And I feel like I wish I would have. I'm glad I know about it now, but like back when I was a trainer and when I was ripped to shreds, it would have been so nice to have this because there were areas based on my personal physique from childhood or whatever, genetics, that I would have loved to sculpt a little bit more.
Absolutely. And that's why sculpting really is the word, or contouring really is the right word.
Right. But I would love to do it now as a busy
We'll
mom.
do it. I mean,
let's do this this afternoon.
Yeah,
Let's-
exactly.
Is it safe
We'll get
while
you started.
breastfeeding, by the way?
It is safe while breastfeeding. What I'd go back to with this is no studies have ever been done during pregnancy or breastfeeding for cosmetic treatments, nor will they ever be done.
Right, of course.
So if you're asking me, and I have a duty to be, very honest, I believe it to be 100% safe. So, but to correct myself here, it's never been tested.
Okay.
So we can wait.
Just
you know what I
wait.
mean?
Yeah.
Like it's.
Yeah.
I mean, like we're not in any hurry. It's really.
I'm not winning a bikini contest.
So but when you're done with that process, then
Yeah.
let's rock and roll.
Totally.
We spoke about the timeline for Botox and the optimal look. I mean, and that will depend on each person. And you said, what was it, 6 weeks later you thought?
What you said.
I think it looks best in
Yeah.
about
But
6
with
weeks.
CoolSculpting, what does that timeline look
That's
like?
a great question. You're going to look worse before you look better because with that
Really?
suction, with that vacuum component, because it has
Yeah.
to kind of suck it in there, you're going to be a little bit swollen. And the destruction of the fat cells doesn't occur overnight. So you're in about 6 weeks to maybe 8 weeks, and up to 3 months, you can start to see really nice result. Now, one other thing about CoolSculpting is I love metaphors because they're just a great way to explain things. The butter dish vacuums the fat in there, but it's the cold that destroys it. That's just to hold it in place, right?
Okay.
So you're numb, it's cold, it's uncomfortable, very tolerable. You just watch TV, it's about 45 minutes. But here's the weirdest part of CoolSculpting. The metaphor I make here is that the cryo, the cold, is making icicles, and we have to break up those icicles. So we have to use manual massage in that area, or we use a device that will manually mechanically
sounds
manipulate.
amazing.
It is it's incredibly uncomfortable, not painful,
Oh.
not
Like a
painful.
massage. Oh.
It's not painful. It is people are ticklish. So it is the strangest thing.
ticklish.
And some people
I'm
hate
very
being tickled.
ticklish
And
too.
I've had the treatment. You are laughing and crying because it's so bizarrely
Yeah.
like,
Wait, this is hilarious.
and it's only in a little area, but you're like, this is such a weird feeling. Please
Oh
stop.
my gosh.
So it's important we explain that in advance.
Oh my gosh, I'm sure it is. That is so. At first, I thought massage. That sounds fantastic.
but then
Different. It's
TV
really
break.
it's like kneading dough. Like you need to break up those crystals, and that will.
Yeah, that makes
you don't
sense.
have to do it, but you'll get a much better clinical outcome when you do that.
Are certain areas more ticklish than
You
others?
tell me. I mean, like that. Like I mean, like back of the
This is
arms
taking a
isn't
turn,
as
Dr.
bad.
Kirby.
I know. Wow. This is so.
Sorry, go ahead.
No, back of the arm is not as bad. Love handles. It's just
course.
bizarre. It's
That's
just
why
bizarre.
they're called that.
Yeah.
Yeah.
Love
the
handles,
love.
so we can love to be tickled right
my
there.
God.
There
Oh
you
my
go.
god!
I like how you put that shoulder movement in there.
yeah.
Yeah.
That is
Not
so.
expecting this to go that way.
Wow.
So just keep that in mind.
Okay.
That definitely will be tickle prepared.
Okay. So you said that the process itself for CoolSculpting, about 45 minutes, is part of that the tickling, or
The
is
tickle
that
is all-
tickling additional?
That's only like 3 minutes.
Oh,
but it is.
It's a 45-minute.
No. But it is strange. It is really strange.
Actually, I'm really glad you said
Okay.
that.
People want to know what to really expect. And if you
Exactly.
haven't told somebody ahead of time, like, by the way,
Right.
this is
is
a
what it
sensation
feels
you
like.
might feel because you're
Exactly.
going
And also,
in
I
thinking,
cannot describe it. It's not
Yeah,
painful.
right.
It's not
Yeah,
nice.
and that's
good.
It's
That's
not
good.
fun. It's not painful. It's just like
weird. It's
bizarre.
odd.
I'm really
It's
glad
different.
you did because I did
Yeah.
this thing. Actually, maybe you can talk about this too. It was a heat version of this.
Yes.
Before.
There's other versions of body
Okay.
contouring that are laser based, and they make heat. Same concept.
okay.
Same concept. Okay.
Did they tickle you too?
It was a very weird feeling. But it wasn't, this one wasn't as tickly as like, I don't even know how to describe it. Like you said, it's just very odd.
that.
Okay.
Like tingly.
The medical literature supports the fact that given those two versions, the cold version seems to work a little bit better.
Okay.
And the tickling portion, it absolutely, unequivocally, indubitably results in a better clinical outcome. So there is a correlation between, and this is true of many things, not just in aesthetic dermatology, but in life, which is the more uncomfortable something is, the more the better outcome will come from
That
it.
is a very
ultimately.
good
So
philosophy.
it
So
is
let's
true.
get uncomfortable
Yeah, let's
together.
get uncomfortable.
Yeah. This is a silly question, but I couldn't not think of this or stop thinking of this. Let's say I come in for CoolSculpting and it is the dead of winter, okay? So when I leave after I've had you know where I'm going with
Yes.
this. Can I turn my heated seat on in
So
my car
I
or would
love
that
this question.
destroy all the work you just did?
I love this question. Once those icicles have been metaphorically broken, the treatment is done, and it's just going to take some time to do it. But I love where you're going with this. The way that this was first discovered, believe it or not, is popsicle paniculitis. So popsicle paniculitis is where you have like toddlers are running around. It's summer. They're poorly behaved. They're all hot, and they have a popsicle in their mouth. They're allowed to have this popsicle, and this has been bona fide in the medical literature many, many times they'll fall asleep, lie down outside, they'll fall asleep, and the popsicle's against their cheek. And the popsicle melts, and they wake up, and they will have permanent, you can Google this, they'll have permanent fat reduction in that area.
What?
Irreversible.
Okay.
And so it's called popsicle paniculitis. Now, the other time this happens is we've seen this again in the medical literature. This isn't just a crazy thing. Look it up. In people who go horseback riding in very cold temperatures, and they're exposed. And when they're exposed, not only the flexure of that flesh being exposed to the cold temperature, but also the actual temperature itself will result in permanent fat reduction in that area.
Okay, we are going to segue to one of our favorite segments. It's called Ask the Expert. So these are questions that have come in from our audience, anonymously. You talked about this earlier, preventative, right, treatments or prejuvenation, right? And I feel like that segues perfectly into this first question, which is what is the best age to start Botox or dermal fillers to prevent wrinkles?
So I get this question all the time, and I love this question. And the answer to this is it's when you start to see the signs of aging that you don't like. So sometimes people who are very stoic, and this can often be national origin, like geographic origin, like if you're Eastern European, they tend to be more stoic just from a personality perspective. They're not as animated. They might not have as many deep wrinkles. Conversely, and we talked about this earlier, if you're someone who expresses yourself through your face, and again, there's
Just kidding.
there's a huge nationality component to this. Italians who like to use their hands and use their face and make these big, they're going to develop those wrinkles earlier. So it's a function of how often you use those wrinkles, and that can be cultural, it can be familial, like within your family, it can be where your origin is, or it can just be genetics. And so but I'm doing a terrible job answering your question. The answer is whenever you start to see those signs that you don't like.
Right.
Now, this is going to sound young, but we treat 18-year-olds for Botox, particularly in the glabella area, all the time. Some people hold stress there.
Yeah.
They literally, while they're sleeping,
I was just going to say,
they'll hold stress.
I will wake up in a frown.
Yes.
It is crazy. I'm a happy person.
Right.
Like, I must be thinking deep thoughts.
You're an angry sleeper.
I'm an angry sleeper.
You know what it
I'm
is?
getting woken
You're
up
the
all
angry
time.
I was going to say, those three boys, you never know when they're going to wake up. It's unpredictable.
So if you hold stress there and you are developing those lines, well, then it may be time to consider that. Now, that area is called the glabella complex. Two muscles,
11s.
the 11s or the 111s, depending on how strong they are. But that's the corrugator. There's two muscles there, and the procerus. And and what we try to do is in that area in particular, that's an area where you can go a little stronger, because if you can't frown, no one's going to say, hey, you're not frowning today.
Right.
So I do, of the areas where I'm very comfortable with people using a neuromodulator in a higher dosage, the glabella is one of those areas, and you'll see it as young as 18.
You don't think that's too young, Dr. Kirby?
So my answer is I want to help you achieve your goals. There's certainly nothing unsafe about it.
Okay.
This is, long term, we know that these products are exceedingly safe.
Exactly.
And they're used in much, much higher doses for medical purposes than we use them in aesthetics. So we know that it's completely safe. And so I think this brings up a really interesting philosophical discussion of which I don't have an answer, which is at what age is it appropriate?
Sure.
Is it 20? Is it 30? Is it 40? You certainly don't want to wait too long, because it's much more difficult to correct a problem than it is to prevent a problem. And that's true of anything in life. We know that to be the case.
Yeah.
But this really comes down to, if you want to really drill in here, it comes down to two different types of lines: kinetic lines or static lines. Now, kinetic lines, also known as dynamic lines, those are lines with movement. And everyone has those. Babies have those, the elderly have those. Everyone has dynamic lines, and that's just moving your face. But when those lines wrinkle and move so many times that they're at rest, when you can see them at rest,
Right.
that's called a static line. And a static line is a fold in the skin, a deeper wrinkle because of that dynamic movement. And once it's there, you can easily address it with a neuromodulator. And so neuromodulators prevent and correct static lines. They'll prevent dynamic lines, which lead to static lines. But
Right.
so the answer is it's based. So here's my answer. Here's my summary. One, it's based on personal experience and clinical need. And two, it's based on, I think, if those kinetic lines are starting to become static lines. And that's really the time you should use it. So if you're 18, get angry in the mirror. I can't do it. And then let it relax. And if you can see that line, it might be time to consider it.
Yeah. I mean, it really made a difference in me starting young and thank God someone was honest with me enough to be like, she worked for Botox, a beauty, what do we call it? Spa. Thank you.
Okay, there you go.
What are those things called? Anyway, she was like, you really need to come in. And I was grateful. I'm so glad that I was open enough, but also that she was so bold to tell me that, because it really did help me to smooth out my skin and to still have expression. I didn't do heavy amounts. I was able to still move my face.
I certainly believe that anyone who is of legal age to make decisions about their body gets to choose what they want to do with their
That's
body.
right.
Also, I don't feel that we should all be looking like an Instagram filter.
Of course,
Right?
of
And because I
course.
think that sets a false expectation for natural
beauty
age progression
standard.
and,
Yeah,
and beauty
you're right.
standards. But I also think if you don't like that line, you can go erase that line if you want to.
That's
I
right.
think that's great that
It's
we
a
have
balance.
access to that.
It's a healthy balance. It's
Yeah,
knowing that you don't
yeah.
need to look like a certain way, but if it makes you unhappy,
Yeah.
then do what,
Absolutely.
Yeah.
So
Yeah.
we talked about neuromodulators. They're FDA approved for 12 weeks. That's neither good nor bad. It's just factual. So if you get a neuromodulator and you don't like it,
It's
good
gone.
news. It's only
Yeah.
going to last 12 weeks. If you get a neuromodulator and you love it, bad news. It's only going to
only
last
la-
12
yeah,
weeks.
yeah.
And I will
Yeah.
tell you though, with neuromodulators, and again, this isn't just my personal opinion, we have access to this N number, this millions of patient database. With neuromodulators in particular, very specifically, that is an aesthetic dermatological treatment that has the highest rate of return.
Yeah, I believe
They're
it.
incredibly sticky. Once people start neuromodulators, they typically don't stop because the result is so predictable, so safe, and you, dollar for dollar, you get a really good value. When we use something like a retinoid, you don't see a whole lot at first, and it does a much better job in the long term. But when you use a neuromodulator, within 3 days, you look better. You just have to kind of ask yourself, this is really sort of a personal philosophical discussion, like what are you trying to accomplish?
Right. I didn't want to look angry and tired. Do you know what I
Right.
mean? Like, I just wanted to look like I was getting some sleep.
You'll never, I mean, again, I'm repeating myself, but if you line up 100 people and you inject them in the glabella and then you bring in a new group of people to assess them, no one's going to say, hey, why are you not angry today? Like, you don't look pissed off today. It just is, it's not how the human mind works. So
Right.
maybe other areas, that they might say, you look a little bit relaxed or you look like you got a good night's sleep. But if you can't get angry, no one's
one
upset
cares.
by
Yeah,
that.
no one's going to be. Well, our next Ask the Expert question from our audience is, how many CoolSculpting treatments are needed to see visible results? Is it a one and done procedure?
So this is kind of what we discussed earlier. It's based on what you're presenting with.
Melissa's
So
one and done.
Melissa's
I'm many.
honestly one and done. Well, the thing is,
I am 100.
these work best with lifestyle modification. So where I think, and this is true of any cosmetic treatment, I think it looks best when you're committing to kind of like feeling your best and looking your best. So, diet, lifestyle modification in the form of diet, exercise, and CoolSculpting, they all go hand in hand.
Right.
And of course, each of those is going to augment the other. But some people need more CoolSculpting treatments than others. Sometimes people need as many as 8.
Oh, wow.
And they could do those over the course of 6 months and kind of prep in advance for summer season. But it depends on the individual.
And as far as the cost for these, do you take financing? Do you take CareCredit?
I love
credit
this.
card?
Feels like a loaded question.
It
Just to get really candid, we're huge fans of CareCredit credit card, and here's why. In our world, patients do best when they commit to the process. If you want to get educated about this and you decide to move forward, and if there's no pressure, well, it is best for you to pay up front and commit to the package. And let's get a really good example of that. With laser hair removal, you need 6 to 8 treatments to achieve your goal. Okay. That's because, and we could talk about this or not, I don't want to bore you, each treatment is going to remove 10 to 15% of the hair because you're only destroying the hair in this anagen phase. So again, it has nothing to do with the device or the provider, or it has to do with human physiology. And only a portion of your hair is in this growing phase at any given time. So you have to get 6 to 8 treatments to get a great result. And those treatments have to be spaced appropriately. On the face, they're typically done about every 4 weeks, and on the body, about every 6 weeks. So it is tricky for patients. I'm not naive enough to think this isn't hard to schedule. We all have busy lifestyles. You have to commit to the 6 to 8 treatments, and depending what areas you're treating, you need to come in every 4 to 6 weeks. So if someone doesn't commit to that entire process, then they're not going to get a great clinical outcome. Let's say you can't space it appropriately, or let's say, more importantly, you miss treatments, or you just don't go to the treatments at all. If that happens, you're not going to get a great clinical outcome. And you're not going to say to your friends, hey, you know what, I got 3 treatments, but I was lazy and didn't pay for it and didn't come back. You're going to say it didn't work.
That's true.
For mentally, and you have to kind of wrap your brain around how the human mind works. When people commit to the process, it's our job to educate them and to hold them accountable, because we want to be a partner in this. So when they use CareCredit to make a slightly larger purchase, it's the best. It's great for us, but it's the best for them. And there's a cost. We have, when you purchase a package, it's there's a better valuation. It's a better price for the patient.
Right.
There's a discount. So for them to use a financing partner like CareCredit, and again, I'm completely biased here because CareCredit, by far, as someone who has explored every financing option, is the best.
Wow.
It just works out best for the patients.
That's awesome. And it really helps them to commit to, like you're saying.
It's the mental commitment to the
Yes.
process. Like with gyms, I think gyms often hope that people sign up and then don't show up.
Right.
We don't want that.
No.
We want people signing up and then committing to their hair removal package. We want their underarms to be hair free, because they're then going to be advocates and they're going to tell their friends and family.
Exactly.
So from a business perspective, it's better for us. And from a cosmetic perspective, it's better for them.
For the client, yeah.
So again, this all comes down to the partnership, right? It's not, these aren't clients, they're not consumers, they're patients. And so we have that ethical obligation to educate them, over-educate them, bug them, and get them to really achieve their goal. If you get the information from us and you like what we do, please come see us. If you get the information from us and we're not right for you, at least you're educated, and in the future you might want to come back.
This is one last Ask the Expert question. It is, and I feel like you've addressed this, but let's pretend you haven't.
Okay.
Is it safe to combine multiple aesthetic treatments like Botox fillers and laser resurfacing?
So in terms of multimodalities and incorporating those in a small time period, not only is it safe, but it will augment the other portions. So
that makes sense.
In terms of the overall cosmesis. So you certainly can get neuromodulators and fillers the same day. You can get neuromodulator fillers and energy-based devices. And in parts of the body, hair removal, cryolipolysis, CoolSculpting, and those are easily overlapped with no problem whatsoever in terms of time. And patients, it's really a function of the patient's schedule. If they say, hey, this is what I want to get done, and today, we can often accommodate that. Now, Botox, again, 12 weeks is typically how long it should last. Laser hair removal, well, you may need to come in 4 to 6 weeks. So it's a function of coordinating those appointments, but it's not that difficult. I mean, we certainly can
I'll
accommodate
just
those
plan all
requests.
day. You just put me in
We'll
your
do it.
schedule all
Let's do
day
it.
and do whatever you need to do.
Yeah.
Whatever, you just like lie there like, doctor, whatever you
me.
decide, go for
Here's
it.
CareCredit, do whatever you want.
Here's my
Here's my
CareCredit credit
card.
card.
Yeah, my credit
Do
card,
what
credit
you
card.
will, doctor.
That's right.
Dr. Kirby, it is so fun
Pleasure's
chatting
all mine.
with
I
you.
love educating, and if you guys leave and they
feel
turn the lights
educated.
out, I'll just keep talking. So
More
thank you.
questions. Good.
We do have more questions. We're going to bring you back. Thank you so
Yes,
much,
Thank
Dr.
you so
Kirby.
much. I really appreciate it. Thank you guys.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.